Good afternoon. This is Dr. Stephen Fales with Talk from Doc. Got my handy Obamacare computer here to help us with our visit today. Just being facetious. You know how I feel about that, constantly having to be on the computer instead of taking care of people. This afternoon I want to say a few words about Obamacare. Have you talked to your doctor about Obamacare? Well, I happen to be quite in the know about it because I study it a lot, and my partners and I talk about it a lot, and it's going to impact us greatly. Some of the basic features of Obamacare you'd think would be easy to determine, but a lay person reading through these regs, I'm not sure you really would be able to decipher it. In fact, nobody knows. It's so extensive and complicated that nobody knows all the ramifications. But there are several. One is you might want to know how it affects Medicare. Well, the facts are that in order to get this on, they had to promise to take a lot of money from Medicare and put it into Obamacare, because somebody's got to pay for these things. In so doing, of course, what about Medicare? Well, they're going to pay us less. That's all there is to it. They're going to make it more difficult, and they're going to have to pay the doctors less and everybody else less. And they're trying to go after fraud and abuse. Well, good luck, because they've been trying to go after fraud for a long time. The big guys, the real criminals, they suck millions and millions of dollars out of Medicare. The rest of us doctors, we just do a little bit of fraud because the symptoms are so complicated, they make us all criminals. But the real fraud, they'll never get after that. The other thing about Medicaid, if you're poor, you can get on Medicaid, really poor. But under Obamacare, you don't have to be quite so poor to be on Medicaid. Now try to go online and find out the requirements to get on Medicaid. You won't be able to find them. You have to apply to get on Medicaid. But there are a few guidelines. If you're really, really poor and you have children or you're over 65, you probably will be able to get on Medicaid. 30 million more people will probably be able to get on Medicaid. But who's going to take care of them? We all see a few Medicaid patients, but they pay so poorly that most of us are like, we just can't do this. You might want to know about your employer health plan. Well, a lot of companies, if it's a big company, they may find it cheaper to pay the penalty than to pay for insurance for you. And if they do, the plans that they use have to provide more and more things, probably for less money. Well, in order to do that, of course, the premiums are going to be rise, and any employer who can get out of paying for health care for his employees is certainly going to do so. What about private plans? Well, you know, people have had a hard time getting insurance in the past for a few reasons, one of which is too expensive. I hate to tell you, but the cost of medical care and insurance plans are going to go up because they're asking more and more of them. They're demanding that they include children up to age 26. Do you know any children age 26? Well, it doesn't really matter. They're adults, but they're going to call them children, and the insurance companies have to cover these children up to age 26. Okay, so what else? Well, the insurance companies have to cover pre-existing conditions. You can't be turned down for a pre-existing condition. Of course, that always has seemed bad, but on the other hand, why would an insurance company deliberately take on somebody that they know is going to cause them a tremendous amount of losses? Well, the government's going to force them to take these people. And who's going to cover the cost of that? Well, we can take some of that money out of the Medicare savings, and maybe we can use that to help reimburse it. But in general, insurance companies are going to go under if they can't raise their fees. They're going to have to raise their fees, and so private policies are going to get more and more expensive. As you can tell, I have quite a bit of energy about this because it's so obtrusive and taking over everything. Well, you may know that doctors can't go on strike. Well, you don't want to go on strike. People need doctors. But the doctors have no power. We cannot negotiate. We can't help you as the patients because we can't get together. Insurance companies can get together and really put the thumb down on us, but we cannot negotiate with them because if we get together to do it, we'll go to jail or get fined by the Federal Trade Commission because that's called restraint of trade. There's a lot of injustices in all that, but bottom line, we as physicians are going to have to lower our income. Well, we don't have to lower it, it's going to be lowered for us, and we need to do more and more to help you, our patients. I can only hope that your family doctor is willing to take less money and still take good care of you, hopefully work longer hours because there's going to be 30 million more Medicaid patients, and of course in a few years we'll have many million more Medicare patients. There's no easy answer, but I'm just bringing up some of the issues. Contact me with any of your questions or responses at advisor@talkfordoc.com, or go to my website, talkfordoc.com, or see me on Facebook. Thanks a lot. Have a good afternoon.